How's it going, everybody? I'm Jamal Sutter, 413th Flight Test Group Public Affairs Specialist, and right now I'm with Captain William Palmer, 413th Aeromedical Staging Squadron Nurse Practitioner, and he was part of the initial wave of Air Force Reserve medical personnel who mobilized to various cities across America in support of COVID-19 response efforts. First off, good morning, sir. How are you doing?
Good morning, sir. Doing great. Doing great.
And also, how's the family back at home? Obviously, you had to leave them. How are they feeling? How are they handling all this that's happening?
Well, I have my wife back home. She's back home with our cats and our dogs. She was a little worried about me coming up here. I think there's a lot of apprehension surrounding COVID-19. So initially she was a little worried. I think she's a little more comforted now, knowing that we have all the proper supplies and PPE here in place.
As far as your assignment, as far as where you're at, what can you tell me and what exactly are you doing and what's your role where you're at?
Okay, so we're here in New York City. We're working with one of the local hospitals. There's 7 providers. We have a total of 32 healthcare personnel in the hospital. We're working in various areas from the emergency department all the way up to critical care. We also have some individuals providing medical support in dialysis. The medical personnel at the hospital were very welcoming. They're very appreciative, and they definitely need us here. These guys and girls will work very hard for about 3.5 weeks before we arrived. So they kind of, took the initial onslaught, that tsunami wave of patients prior to us, getting boots on ground here. But yeah, so that's where we're at.
You kind of mentioned it a little bit, but can you go into more detail? What's the feedback been like once the reservists hit the ground running with helping the medical facilities out there? What's been the feedback? What have you been hearing, and how are they receiving you all?
Oh, they're very happy to have us here. So a lot of the providers, as well as the nurses in the hospital, had worked anywhere from 2 to 3 weeks straight without a day off. A lot of their staff has also become sick. So they've had some lost time and lost service due to illness. So I think we came in at a great time to provide support. I do know that every evening when we get off the bus, we're heading back to our hotels. The local citizens in New York City are cheering us on. They're hanging off the balcony. They're yelling and screaming to us and support. So it's a beautiful experience.
And you've been on location for about a week, give or take now.
Yes, sir.
Leading up to being departed and heading out there, what was that like? Was this something you volunteered for? And what was your mindset in choosing to volunteer if you did do that?
Yes, sir. So in the volunteering support, I had roughly about a 14-hour notice, heads up that I would be leaving out. So I was called on Saturday, April the 4th, and I had to be on the road at 4 o'clock in the morning, Sunday, April the 5th. So, it was no question. When I got the call, there was no second thought. I said, yeah, go ahead. Let's get what we need to have done. And let's get everything in place so that I can be there to provide support. I knew the people here needed it. So as far as, getting prepared for it, last minute, I just had to grab a few items, toiletry items, and pack my bags and be ready to roll.
And what's been the support that you've gotten from your ASTS and flight test group family back at home? What's been the reception? What have they been doing to help you out and things of that nature?
I think a huge step up was Colonel Zidek himself. Since it was such a short notice, drove me from my home up to Forsyth, and then the chief drove me the rest of the way up to Dobbins Air Force Base to catch my flight out to New York. And then my unit has reached out to me almost every day. They're touching bases, making sure that I don't need anything. Thankfully, there are some local stores that are open here, so there's not much that we need. But they've been very supportive, very supportive.
And obviously, what you're doing is can be a nerve-wracking and maybe even dangerous assignment.
Sure.
Were there any concerns? What's going on through your mind as you're touching down, and what's the city been doing to kind of sort of mitigate those concerns and potential for you to get the virus?
Right. So you don't know what you don't know. So there was a huge question of what to expect when you're here, because in our local area, where I come from in Warner Robins, Georgia, there really wasn't a huge COVID outbreak. So we weren't experiencing the same things that they're experiencing here in New York City and in other pockets across the nation. So, I really didn't have any expectation because I wanted to kind of see it firsthand. So, there was a bit of apprehension though, because I know that coming here, there is a risk that I, potentially get COVID, and I fully anticipate, being infected with COVID because we're in patient care with COVID patients during my service here. But things that the city are doing, as well as the hospital, or in the hospital we have full PPE, so we're wearing N95 respirators with surgical masks on top. We have face shields, we have full gowns, we have hair covers, shoe covers. So we're pretty much from head to toe, we're covered in proper protective equipment. There's not been any supply shortages. We've had everything that we needed every single day. As far as the city, I believe the mayor as well as the governor have mandated that you have to have a mask on at all times, as well as maintaining social distancing when you're out in public. And from what I see, a large majority of the people are abiding by that. The local citizens, all the military personnel, prior to even touching down, we were administered gloves and masks. And so you see us throughout the city. We're pretty, we stand out. So, but we all have our masks on. We all have our, and we're not wearing gloves every day. We do have hand sanitizer that's been dispensed by our leadership. And I think it would be, wasteful. And I agree, I don't think we need to wear, gloves out in public when you have hand sanitizers and access to sinks. However, we do have our masks on every day, especially when we're out in public.
Okay. Now, how similar or different is this than any other mission, training environment, real world mission that you've been on or conducted or been part of?
So this is our war. This is the war for medical professionals. So we're here on the front lines and we're fighting COVID-19. This virus that's very virulent. It's taking people's lives. So this is our time to stand up in support of our nation. This is a very, very trying time because there are patients who are still passing away every day. But we're there in the hospitals with them. We're there holding their hands. Unfortunately, their family can't be with them when they pass away. So it's up to the medical providers to be there, to be that patient advocate, to stand up for their patient, and to make sure that even though if they ultimately pass away from this disease, that they die in comfort.
And has the virus affected you personally, you and your family in any way?
Thankfully, no one in my family has been infected with this virus. Knock on wood, hopefully that trend continues. However, if we face the reality, at some point, I'm sure it will affect my family. So.
Well, sir, we definitely appreciate what you're doing. From me, from the entire 413th Flight Test Group family, the reservists in America, we appreciate what you do. I mean, you're, like you said, you're out there on the front line, and it's a risky business, but you're out there doing the job, and you can't thank you enough. Be safe, get back home safely. Is there anything else you'd like to add about this?
No, just glad to be here. Glad to be able to have the necessary skills to provide support here. So just thankful for the opportunity.
All right. So once again, I appreciate your time and thank you for taking time out of your busy day. I know you have a crazy schedule. So again, be safe and we'll see you soon.
Yes, sir. Thank you for having me.